Hello students, welcome to today's class. I am Bernisha, lecturer from Emmanuel Arasa College of Pharmacy. Today we are going to discuss about psoriasis from pharmacotherapeutic subject. In this video, we will completely explain or learn about psoriasis, its etiology, pathogenesis along with their pharmacological and non-pharmacological management. Okay students, let's get into the video. First, let's see what is psoriasis. First, let's see what is psoriasis. Psoriasis is most common skin disease. It's thought that this is the chronic stems from the hereditary effect that causes the overproduction of keratin. Usually, psoriasis is the most common skin disease, which is nowadays it's more prevalent among the people. It's a chronic disease. It's mainly due to the causes of overproduction of keratin. So next will be what is psoriasis? So psoriasis is a chronic non-infectious skin inflammations. It's not an infectious disease. It's mainly involving the keratin synthesis that results in psoriatic patches. Usually, we can easily identify the psoriasis through its psoriatic patches. So it's an inflammatory skin disease. That means it also undergoes some of the inflammations. After that inflammations in which the cells replicate in an extremely rapid rate. So here in the extremely rapid rate, the cells get replicate and the new cells are produced 8 times faster than the normal, but the rate at which the old cells slugged off is unchanged. So here mainly we know that the cell replicates which will be extremely rapid, but the new cells production is 8 times faster, but the old cells slugged off is unchanged. This causes the cell buildup on the skin surface. It forms a thick patches or plaque of red cells, which is covered with the flaky silvery white dead skin cells, which is known to be the scales. So we know that the psoriasis is a chronic non-infectious skin inflammations which involving the keratin synthesis, which that results in the psoriatic patches. So next let's see about So next we are going to learn about its etiology. Usually the etiology of psoriasis is unknown, but moreover sometimes it may also caused by genetic factors. Some factors may also aggravate the conditions of psoriasis like stress, smoking, alcohol, trauma, obesity, hormonal changes, climate and autoimmune diseases. Sometimes the medications which we are taking for certain diseases like lithium salt beta blockers can also aggravate the conditions of psoriasis. So the common etiology of the psoriasis is unknown, but however mostly it is an autoimmune disorder or genetic disorders. Some of the factors which aggravates the conditions of psoriasis is stress, smoking, alcohol, trauma, obesity, hormonal changes, climate, autoimmune diseases and medications which we are taken for the other diseases like lithium salt and beta blockers. Next will be the types of psoriasis. There will be more than 6 to 7 types of psoriasis. Usually, the most common type of psoriasis is plaque psoriasis. So, this plaque psoriasis is also known as psoriasis vulgaris. It's mainly appeared as a raised, inflamed red skin. So, we can see in this picture, it's like a raised, inflamed red skin, which is covered by a silvery patches or scales. Here mainly it affects the elbow, knee, sacrum, scalp, hands, feet and lower back. This plague psoriasis is the most common type of psoriasis. It is also known as psoriasis vulgaris. It's fully raised, inflamed red skin which is covered by a silvery patches or scales. Usually, it occurs near the elbow, knee, sacrum, scalp, hands, feet, and lower back. So the next will be the guttate psoriasis. Guttate psoriasis. Usually, this guttate psoriasis occurs when there is an infection. There is an infection by the Streptococcus bacterium. So, this guttate psoriasis is like a eruption of small papullae. We can see in this picture that there will be a small bumps. So, this bumps contain some of the pus inside it. So, the eruption of this small papullae like chickenpox, smallpox. So it's over the upper trunk and the proximal extremities. So proximal extremities like hand, legs, etc. So this like the eruption of small papullae is known as the guttate psoriasis. And the next one will be the inverse psoriasis. In these conditions, there will be only the folds of skins, but there is no other scales or inflamed skins or reddish brown skins. It is found that the skin folds such as inguinal axilla and sweating areas. Mainly in the sweating areas, the skin gets unfolds. So that this type of psoriasis is known as inverse psoriasis. Here the scaling is minimal or absent, but the lesion appears very glossy, smooth and bright red. So here mainly the scaling is minimal or absent. The scaling of the skins is very minimal. So the next will be the pustular psoriasis. Pustular psoriasis, we are also known that pus means it is filled with pus. So the small lesions which is completely filled with the pus. So it is surrounded by the red skin. It mainly appears on the hands and feet. In this picture, we can see like it's like a small white dots, but that white dots, inside the white dots there will be the pus, fully filled pus inside. So they are called as the pus filled lesions which is surrounded by the red skin. Next will be the erythrodermic psoriasis. So erythrodermic psoriasis, it is a superficial scaling, peeling that may appear like burning. So it's like sunburning. It affects all the body sites. Mainly it causes is sunburn, allergic reactions, and also the strong cold product use. So the erythrodermic psoriasis is the upper major occurs at the dermis areas, and it is superficial scaling or peeling that may appear like burning. So it affects all the body sites. Not only the certain sites, it affects all the body sites. It causes due to sunburn or allergic reaction and also the strong cold product use. So the next will be the nail psoriasis. We have already learned that the nail psoriasis means the psoriasis which affects on the nails. So it appears as a small nail or yellow or brown nail with the chalk-like debris built upon the under the nails. Moreover, the ordinary nails or the normal nails looks like a certain strong or long nails, but in nail psoriasis, it's like a small nail with yellow or brown nails with the chalk-like debris built up under the nails. So the next will be the psoriatic arthritis. So arthritis means nothing but the inflammation occurs at the joints. So in these conditions, it involves both the psoriasis as well as the joint inflammations. While we are learning about the pathogenesis of the psoriasis, we can easily understand the concepts between the inflammation as well as the psoriasis. So psoriatic arthritis is nothing but the conditions which involves both psoriasis as well as the joint inflammations. Next will be the pathophysiology of psoriasis. Due to some of the environmental factors, we have already learned that the etiology of psoriasis. Here the environmental factors which include stress or the use of other drugs for the certain diseases like lithium drugs or beta blockers. Due to this, all the environmental factors, it may increases the hyperactivity of the T cells. These T cells is very much important for the immune system, immunity of our body. Once there is an hyperactivity of the T cells, it may leads to epidermis infiltrations. Epidermis is the outermost layer of the skins, and when it undergoes the infiltrations, it may lead to keratinocyte proliferation. Keratinocyte proliferation is nothing but we have already known that the psoriasis is caused by the production of keratin. So once there is a keratinocyte proliferations, it may leads to deregulated inflammatory responses. I have already said that the inflammations and also connected with the psoriasis. Once the keratinocyte proliferation occurs, it may leads to deregulated inflammatory responses. So after that, the deregulated inflammatory responses, there will be the large production of various cytokines. Cytokines is nothing but the inflammatory mediators. Once there is the large production of the cytokines, it may lead to the superficial blood vessels dilations or vascular encroachment. Once the blood vessels are dilated and the vascular encroachment occurs inside the blood vessels, it may lead to epidermal hyperplasia and improper cell maturations. We have already said that the psoriasis increases the new cells by 8 times faster, but it stops the sludge of the old cells by normal range. So, when there is an improper cell maturation, it fails to release the adequate liquid, which leads to flaking, scaling, presentations of psoriasis lesions. And it may also lead to the silvery scale of the skin. So, when there is a due to this environmental factors, it affects the hyperactivity of the T cells. Once the T cells gets undergoes hyperactivity, it may lead to epidermis infiltrations and keratinocyte proliferations, which may lead to the deregulated inflammatory responses, and so that it may lead to the large productions of various cytokines. Next, the superficial blood vessels gets dilated and leads to vascular encroachment. After that, it may lead to the improper cell maturations and fails to release the adequate liquid, which leads to flaking, scaling presentations of the psoriasis lesions and causes the silvery scale of the skin. So, this is the pathophysiology of psoriasis. And the next will be the clinical manifestation. Clinical manifestation is nothing but the symptoms of psoriasis. It's mainly first the sign of psoriasis is the red spot on the body. Red spot means so it may occur in any part of the body. Moreover, Mm. So, when there is a sudden red spot in the body, we can see that it may be a sign of psoriasis. And the next will be the patches of skin is dry, swollen, and inflamed, covered with the silvery flakes. So, the patches of the skin is mainly dry, swollen, and inflamed, which is covered with the silvery flakes, raised, and thick skin. So these are the some of the clinical manifestation. First will be the red spot, and next will be the skin is dry, swollen, and inflamed, covered with silvery flakes, raised, and skin. So next will be the pain, itching, and burning. So pain, itching, and burning. So pain, itching, and burning. The yellow discoloration, pitting. Pitting means nothing but there will be the formation of pores. Next will be the thickening of the nails. The nails get thickened and noted if they are affected. Cracked and bleeding points if the scales are scraped away. And next will be the Kopner phenomenon. It is developed at the site of injury such as scratch or sunburn. These are some of the clinical manifestation of psoriasis. Next will be the diagnostic evaluation. First, we have to, in the diagnostic evaluation, we have to check the history physical examination, skin biopsy, along with blood and radiography to rule out the psoriatic arthritis. So, first we have to check the history of the patients. Along with next we have to maintain the physical examinations along with the skin biopsy. So, with the help of the blood and radiography, we can easily rule out the psoriatic arthritis condition. Next will be the management of psoriasis. So the management of psoriasis involves topical treatment. So it's slow, overactive epidermis. Next will be the topical corticosteroids. Usually the corticosteroids are used to treat the inflammations. So we have already learned that the psoriasis is also associated with the inflammation conditions. Once there is an inflammation, in order to release that inflammations, we can use this topical corticosteroids. They may slow the turnover by suppressing the immune system, which reduces the inflammations and relieve itching. So next will be the topical steroids. So first main treatment will be the topical treatment and the topical corticosteroids. Next is the vitamin D analogs. Calciopterin, it suppresses epidermopoiesis. So once the epidermopoiesis, development of epidermal cells. So it causing the slugging of growing epidermal cells. So vitamin D analogs are used to develop the epidermal cells, and it also reduces the slugging of growing epidermal cells. Next will be the coal tar. Coal tar is nothing but dry distillation product of organic matter heated in the absence of oxygen. Once which is heated in the absence of oxygen, which combines with certain creams and ointments and pastes which is used in the treatment of psoriasis. Next will be the tazarotene. So it reduces mainly the scaling and plaque thickness, normalize the DNA activity. Next will be the topical calcineurin inhibitors. It is an drugs which is used to treat the autoimmune disorders. So this inhibits the calcineurin inhibitors that tracholymers, which inhibits the activation of the cells, which reduces the inflammations and the plaque buildup. And the last one will be the emollients. Usually we have to use emollients, which is similar to that of the moisturizers, which is used to avoid the dryness of the skin and to reduce the scaling and limit pain. Next will be the phototherapy. So first will be the sunlight. Activated seed cells in the skin are destroyed, lead to the reduced scaling and inflammations. Next will be the UV broadband phototherapy. So it is like an artificial light therapy which is used to treat the psoriasis, which activated T cells gets destroyed and leads to the reduced scaling and inflammations. Next will be the photochemotherapy plus UVA, light sensitizing medications taken before the exposure to UV light. Usually, these medications are taken before the exposure to UV light. Next will be the excimer laser. The excimer laser means controls the beam of UVB light directed to the psoriatic plaque to control scaling. Next will be the pulse dye laser. It will destroy the tiny blood vessels that contribute psoriasis. Systemic therapy, example cyclosporin, methotrexate, and acitretin. So these are some of the systemic therapy which is used to treat the psoriasis. Some of the complications may also involve with the psoriasis. It includes psoriatic arthritis and erythrodermic psoriasis. So psoriatic arthritis is nothing but the psoriasis may also accompanied with the inflammations on the joints. So these are some of the complications which is affected with the attached with the psoriasis. Next will be the nursing management. For the nursing management, first we have to uh, get the proper diagnosis. So impaired skin integrity related to the Lysines inflammatory response as evidenced by the itching all over the body. Next we have to get the nursing goal to maintain the skin integrity is the main goal of the nurses. So first, what are the interventions we have to given to the patients who are affected by the psoriasis includes to advise the patients not to scratch the affected areas. Next, too frequent washing produce more soreness, and scaling water should be warm and not hot, and skin should be dry by patting a towel rather than rubbing. Next will be we have to apply a thin film of emollients after washing the area. Next, provide a calorie and high protein diet. So these are some of the interventions we have to given to the patients who are affected by the psoriasis. Next will be the nursing diagnosis. First, we have to the risk of infections related to hypernatremia as evidenced by loss of protein and fluid from lysines. So, in these conditions, what will be the nursing goal is to prevent the patients from infections. While preventing the patients from infections, it may have some interventions. First, we have to monitor the vital signs. Next, we have to examine for signs of infections. Keep the lysines. We have to keep the lysines completely clean. And we have to motivate the patients to improve the nutrition, and we have to provide them with the good antibiotics. So these are some of the interventions which is given to the patients to prevent the patients from the infection. Next, the nursing diagnosis, which includes acute pain related to the inflammations as evidenced by patient verbalizations. So we have already learned that psoriasis can also be related with the arthritis. So the nursing diagnosis can also be related to inflammation as an evidence by the patient verbalizations. So the nursing goal in this diagnosis includes to reduce the pain. In this interventions, we have to provide emollients after washing the area. It will relieve the soreness, and it will provide some comfort measures, and to provide the pain medications which relieves the pain. So these are some of the nursing diagnoses which are related to the psoriasis. So we know that psoriasis is a chronic skin diseases which mainly related to the skin disorders. Okay, students, I hope we all have learned about psoriasis, its etiology, pathogenesis, clinical, pharmacological, and non-pharmacological management. I hope you all have learned completely about the psoriasis. Let's see in the next video. Thank you.